Well, the number one question is, they're just baby teeth, we don't need to fix them, right? They're gonna fall out anyway. This is not correct in many ways.
Dr. Irene Lau, a renowned pediatric dentist and global advocate for children's oral health. From New York to Hong Kong, she's co-founded leading clinics, launched Hello Smile HK, and drives worldwide efforts to transform children's dental care.
Well, there's a lot of saying that baby teeth are not important, When do you expect parents, or when should parents bring the kids to your clinic?
Kids are supposed to come in by when the first tooth erupts, or latest by age 1.
The industry has always talked about breastfeeding, and everybody says that breastfeeding is good. What does it do for growth and development? And how does it help?
And with a narrow palate, the tongue will have no space to fit into the mouth. So then when they're sleeping, this tongue is down and it's on the airway, it's blocking them from breathing properly. One child came in for a routine checkup. Mom also told me that he was diagnosed with ADHD. After the surgery, off his medication, and he has become a different child. Parents find it cute when the kids are snoring, but it's not cute. They're not supposed to be snoring unless they're really tired or they're sick, right?
Yeah.
But more than 3 times a week of snoring, definitely not okay. Something is wrong. Something's blocking their breathing.
All right. Pacifiers are always bad.
It's like a controversial question.
A very good morning, everyone. Welcome back. We've got Dr. Irene Lau with us today, and she's a dear friend. And when I first met her, I visited her clinic, and it was like my dream clinic with kids' playroom that was so inviting and well thought out. And she has been a real inspiration to me for what she's doing, and that's why we've invited her today. So, as a co-founder of 2 big multidisciplinary clinics, as well as founder and of this non-profit organization, Hello Smile, to help the underserved community and children. For those who may not know you, how would you describe or introduce yourself? Yeah.
Thank you, Dr. Jeanette. It's a pleasure to be here today. So my name is Irene Lau, and I'm a pediatric dentist. And I was born in Hong Kong originally and raised in the U.S. I finished my dental school at NYU, New York University. Then I went on to do my general practice residency at New York Hospital, Queens. After that, I actually was a general dentist for 1 year, and which I did not like too much. And I went on to specialize in pediatric dentistry at Mount Sinai, New York. About 15 years ago, I moved back to Hong Kong, and that's when we started our practices in Hong Kong. And subsequently, I started the Hello Smile in Hong Kong.
I see. As a specialist that focuses on pediatric dentistry, what aspects of pediatric dentistry that you find most rewarding?
I believe what I find the most rewarding, it's actually also the reason why I went into pediatric dentistry. It's really fostering the connection between my patients and their parents, and watching them grow, from a kid that's very fearful turning into a kid that's very confident, and just watching their life experiences. It's rewarding for me. Yeah.
No, I think treating children is such a blessing, and they bring such joy to everyone.
Definitely, yes.
Yeah, but I think a lot of us as dentists, a lot of us don't even want to treat children because they are hard to treat. So it's amazing at what you do. How do you handle kids that are quite impossible? Now.
Yeah. So the number one thing with children is the fear of unknown. Right? Yeah. So if you're able to connect with them and tell them what's going on and gain their trust, then things become a lot easier. Yes.
A lot of patience, I would imagine. You got to spend a lot of time.
Yes, definitely.
Okay. You started your journey on pediatric dentistry, and now you have gone on to myofunctional therapy, airway, modifying growth, development to help prevent sleep apnea in kids. And why did you go into this field?
About 10 years ago, I had a patient come in asking me about myofunctional therapy, asking me about different appliances for the airway. I had no clue, and I was not trained that way, and I'm pretty sure many are not. We did not learn this in dental school. And so I decided to look into it. First course I took was actually a myofunctional or myobrace course. And then I discovered that was just a little piece of the puzzle. And the more I learned, the more pieces of the puzzles I put together, it changed the way I practice completely. And a lot of the mysteries in pediatric dentistry was solved in a way. Like dental cavities. Why are they getting a lot of dental cavities? Why are they grinding their teeth at night? Why are they not growing properly? Why did they get the class 2 occlusion? How did that happen? Things like that. Yeah. And so I practice completely different now. It's more on the entire, the more holistic growth and development, treating a child, not only treating teeth. We're treating the whole child. Yeah.
No, I think that's so important because when I first met you and realized what you were doing, I said, this is going to change the way the public view dentists and the way how parents think that dentistry is just dentistry. Is more than dentistry.
It's more than that. Definitely. Definitely more than that. We're not just teeth doctors. I guess at this day and age, we're treating all our patients as a whole. Yeah. If we don't do that, we're probably failing our patients in a way. Yes.
No, part of the reason why we run this talk, it's also because everybody thinks that if you're a pediatric dentist, you just do pediatric dentistry. You're a periodontist, you just do perio. You're a surgeon, you just do surgery. But even in dentistry itself, it is so confusing. In actual fact, we need to know a little bit of everything, and we need to know what the treatment options are and how people diagnose properly.
Yes, definitely. Yeah, we need to all work together in a way. Yes. And a lot of times pediatric dentistry is really on the bottom of the totem pole in the entire dental field. But pediatric dentistry is very important because we're setting the base for these children and their attitude towards oral health, their growth and development. And in a way, if we mess up as a pediatric dentist, we fail to treat these children properly, then what eventually happens, then your periodontists are treating these cases to correct the problem that was not set correctly when they were young.
That's true. That's true. It's more than that. I mean, you affect the whole life.
Yeah.
And you affect how dentistry is going to play into their life.
Exactly. Yes.
And that's so pivotal, actually,
in
what you do. And a lot of people don't realize that.
Definitely. Yeah. Baby teeth are important, you know.
Well, there's a lot of saying that baby teeth are not important, you know. When do you expect parents, or when should parents bring the kids to your clinic?
Yeah. So, according to the American Academy of Pediatric Dentistry, kids are supposed to come in when the first tooth erupts, or latest by age 1. And parents ask me, they don't have teeth yet. Why do we need to come? For obvious reasons, for prevention. We not only check the teeth, we actually, cavity is 100% preventable. So we give them a lot of anticipatory guidance. Oh, can you feed overnight with a bottle? What about pacifier, thumb sucking? How does it affect growth and development? How do you prevent dental cavities? Are you supposed to use toothpaste or not? So we do a lot of preventions when they're in younger years to ensure that they are growing properly. Yeah.
I think what you've just mentioned is so important because a lot of people think that going to a dentist is only to treat teeth or clean their teeth and bring the kids to clean their teeth. But it's a lot more than that.
A lot more, definitely. Yes.
That needs to be looked into.
For example, breastfeeding. It's good for jaw growth and development of the jaw. Pacifier and thumb sucking. It actually causes malformation of the palate. And a lot of times when it's prolonged, these changes, sometimes it's very hard to correct later on. So if the parents knew this information, had this information when they much earlier, then they could have done things that could prevent these malformations. Yeah.
coming back to the palate and breastfeeding, I think the industry has always talked about breastfeeding, and everybody says that breastfeeding is good. But in actual fact, what does it do for growth and development, and how does it help?
Yes. So when children are breastfeeding, the tongue would actually have to go up to the palate to suck and swallow. And this helps the palate grow wide. And this is what we want. Versus when kids are on the thumb or a bottle, it holds the tongue down. The tongue is not able to go up to the palate to help this, to maintain this wide palate, to help the palate grow. So it makes a huge difference, and a lot of parents don't know.
Yeah. I think that's one of the things that gets into this airway problem.
Exactly.
Can you illustrate a little bit of what the effects can be when you start getting into a narrow palate and airway problem? Yeah.
So we know that first, when you have a narrow palate, our children are not going to have enough space for the permanent teeth to come in properly. And with a narrow palate, the tongue will have no space to fit into the mouth. So then when they're sleeping, this tongue is down and it's on the airway, it's blocking them from breathing properly. And as a dentist, looking at the airway, besides looking at the turbinates, adenoids, tonsils, where we have our ENT and respiratory medicine colleagues to look after, as a dentist, we look in the craniofacial development and the tongue. This is our responsibility to help prevent airway issues. Yeah.
No, but it's so critical. And what you've just mentioned, that I don't think in dental school we learn all these things.
No, I did not learn also. But so this is why it's important to go on to continue education. We need to be constantly learning about new things. Medicine and dentistry is always evolving. There's always information that we did not know. And this is the only way to be able to treat our patients properly.
That's true.
I think,
That's true. Treating our patients properly, and that's one of those things. I think coming from your point of view, what I was trying to get to is that prevention is better than care.
Definitely.
Than treatment, than
Definitely,
cure.
especially with children with airway issues. If you're able to reverse them when they're young, they grow well, they live well, healthy later on. But the missed milestones, or the kids that we have missed, they grow up to be adults with sleep apnea, for example. And that requires a lot of different surgical procedures, a lot of different interventions. And we may not know even whether it will work well on them or not. They have to do different trials to try different treatments. But with children, it's a lot easier. The treatments are a lot easier, and they were able to reverse a lot of these effects for them. Yeah. So setting the base right is very important.
Yeah, I like that one. Yeah. Setting the base right. On social media nowadays, there are lots of advertising going on. And of course, dentists and public and companies go out there and sell items such for maxillary expansion, because this is the trend now. Everybody wants to expand the maxilla for kids. There are so many products out there. Is there one that can cure all this? Or how do you
there's no one size fits all, right? Everyone's different. Every case I see, all the airway cases that I see, everyone has different issues. And I believe diagnosing what the problem is first the most important. And then you figure out whether it's, is it myofunctional issues? Is it the jaw development? Is it an narrow palate? And then you plan a correct treatment plan using the correct appliances or the correct methods to treat it. So there isn't one appliance that does it all. Oftentimes when I do my cases, it's a combination of different appliances or different methods to improve their growth and development. Yeah.
Yeah. I think the message is really that there's no one appliance that's going to treat it all. And without diagnosis, don't prescribe things to the kids.
Exactly. And I feel like a lot of times we need to be monitoring the patients properly as well. Even if you prescribe an appliance, with children, there's a lot of compliance issues. And the parents need to understand what's going on with these appliances. They need to be monitored properly to improve or to correct the problem. Yeah.
That's true.
Yeah.
Can you share a story with us on a child or a family that what has changed upon receiving or start looking into their sleep-related issues? Yeah.
There are many stories, honestly, but most of the stories surround the issue with ADHD diagnosis. So, for example, one child that I had, he came in for a routine checkup. Cavity, had pain on the tooth, needed a pupectomy, crown. But with my assessments, I always go over the sleep issues. I have a questionnaire where they fill out whether they have any sleep issues. And then I asked, they check a few issues. For example, waking up at night, bedwetting, and this kid was already 8. He was still bedwetting, unfocused. So I started asking the parents about the sleep. How is he sleeping? And then I figured that I probably should send this kid to the ENT to check the upper airway to see whether there's any obstructions. And then the mom also told me that he was diagnosed with ADHD recently. And the family, mom and dad, had a huge argument about whether they should give medication to this child or not. To a point where the parents are not talking to each other.
Oh, that's so sad.
So after they went to the ENT, my patient was diagnosed with sleep apnea. And he had some surgical intervention. And after the surgery, a couple months later, they came back for a regular routine dental checkup. And the mom had told me, he's off his medication and he has become a different child. Even like the school has made comments that he's more focused in school, he's learning better. And what almost, caused a breakup in the family. It was just, you sort out, you make the right diagnosis, sort out the problem for the child. And, he did not have ADHD. And so it's our responsibility to assure our patients they live well, they grow well. Yeah.
It's so heartwarming. It gives me goosebumps to know that we as dentists can actually change people's lives.
We can.
Yes.
We can, absolutely. If we are looking at our patients holistically, not just focusing on just the teeth.
Yeah.
And we're beyond that at this era.
Yeah. You're right.
Yeah.
You're right. And that's why we're doing this as well, sharing as much information as possible to our colleagues as well as the public. And there's so much of misinformation as well.
So much misinformation, definitely, yeah.
And it's quite scary. What is the biggest misconception you wish more parents understood about early childhood dental care?
Well, the number one question is, they're just baby teeth, we don't need to fix them, right? They're going to fall out anyway. This is not correct in many ways. Baby teeth are very important. They maintain the space for our adult teeth to come in properly. And they also are important for our children to eat with. They need to chew and eat and grow properly. And so in many ways, baby teeth are very important. They set the base for their growth and development. Yes. So this is why we advocate for prevention, or they need to be seen latest by 1, not when they are 6 the first time. Yeah. Which a lot of parents think, we don't need to see the dentist until much later on. Yeah.
I mean, this brings me to the topic of when should a child first see a dentist, as you have explained as 1. But can you explain the definition of dental neglect from the eyes of American Academy of Pediatric Dentistry and Child Abuse Subcommittee of Clinical Affairs Committee that I was shocked the first time I heard that, it's child neglect and child abuse for dental neglect.
Yeah, so according to the AAPD, child neglect is, let's say the parents know their cavities or a lot of pain on the teeth, and they willingly not seek treatment, even when they have the access or the means to seek treatment. And this can be considered child abuse, where the child is suffering from pain or abscess or swelling, and they can't eat properly, they can't grow properly. meanwhile, they have the access. So this shouldn't happen to our children. The children need us to take care of them. And if we can't take care of them properly, it is, to me, it is child abuse. Yes. Yeah.
It's very sad. Some parents.
Very.
Yeah.
And it shouldn't happen.
That's what brought you to do Hello Smell. That's what I would assume.
Yes.
So can you explain to us what Hello Smell means and what do you guys do?
Yes. Yeah. So 15 years ago, when I moved back to Hong Kong, I started seeing Hong Kong patients or children in Hong Kong, and I realized that in Hong Kong, children under 6 years old have no government support whatsoever on dental care. And there's a lot of the other thing I noticed was when I was in private practice, we started private practice in Hong Kong, I didn't see any special needs children. And I keep asking my colleagues, where are they, you know? But then I realized a lot of places in Hong Kong is really not accessible to our special needs children. So then a few years after I moved back to Hong Kong, I decided to start an NGO. Perhaps I could help some of these children that needs help, or low-income families or special needs children. I can use my skills to help them. And because the reason why I got into pediatric dentistry, it's really because of that. There's a lot more meaningful things that you can do, and this is very rewarding in a way. Or else I feel like there isn't a purpose in what I'm doing. So I started the NGO, and it's called Hello Smile, because I want to bring smiles to all these kids and families that needs help. Yeah.
No, that's so inspiring. That's so inspiring, because I think a lot of what we do in dentistry is not just the patients that walk through our doors, is what we do to help serve the community as well.
Yes, yeah. There's definitely a lot of these pockets that we can serve. Yes.
Yeah. Well, if you could change one thing about how we approach children's health in Asia, what would it be?
I think now it's time for pediatrics, for different disciplines in medical and dental to work together. Especially now knowing all the airway issues. As a dentist, I cannot work alone. I can correct the jaw development. But I need our pediatricians to help me correct, for example, allergic rhinitis, to clear the nose so they can breathe properly. I need my ENTs to work with me to help block the airway. And I also need, osteopaths to properly correct the kids' alignment when they become mouth breathers. So everyone would start working together to help our kids grow properly. And I think that's what we need to do in Asia. Sometimes I feel like not only in Asia, probably and elsewhere too, we need to start working with our medical colleagues. Yeah.
I think that's a difficult thing, because we are in this intersection space of the oral cavity and health and airway. And I think, unfortunately, there's two routes where some dentists are beginning to do a lot of appliances or do a lot of treatment without even consulting the ENTs. And where do you see this going into? So as we all know, us dentists, we only fix one part of the face, right? Unfortunately, medical and dental, we had separated our specialties into the nose. Someone does the nose and then we do the mouth. But now we know with research that to treat airway for our children, to help them grow properly, it needs to be a multidisciplinary approach. Any single discipline trying to work on it will not have a successful outcome. And let's say we know in research that ENT surgery, clearing the upper airway obstruction, a lot of times you have a lot of these residual cases, residual OSA cases. And a lot of times we need to be looking whether, is it the jaw development that's still blocking the airway? Do we need to move the mandible forward so the oropharyngeal airspace is bigger? And only with this approach, we're able to help our kids.
or even adults.
Yes.
Yeah.
Yes. I think the kids eventually will grow into adults. And
Yes.
that's why
Yes.
you play a very critical role in
Yes.
dentistry to ensure that we pick them up early.
Yes.
Yeah,
Yes.
we pick them up early.
I always joke with my colleagues because I was saying if us pediatric dentists or our medical colleagues that see children, if we are able to treat these kids properly when they're younger, there will be no treatments later on for our other disciplines to do because they're all growing well.
Yeah, that's true.
Yes.
That's true. No, but I mean, there's enough kids in this world that we need to treat, and the more we prevent, the better it is.
Definitely.
Yeah.
Yes.
The more we prevent.
Definitely.
Yeah. What's the one thing that you hope every parent or teacher or young dentist listening takes away from this conversation that we are having today? Yeah.
I believe that everyone that sees children should be aware that prevention is the key, no matter what it is. They need to seek early treatment. They need to help our kids grow properly, and this is the only way. Yes.
Yeah, that's true. And I think getting to the right diagnosis and not just I see a lot of over treatment nowadays with kids.
Yes.
Oh, that's another one.
Yes,
How
definitely.
would you advise parents to not jump into it, quickly without realizing what's going on?
Well, so I guess parents can also do their own research. There's a lot of research out there with different medical or dental issues, airway issues. They can read on it as well. They can seek second opinion with different specialties to figure out what they should do or not do. It is hard sometimes with when a parent they don't have the medical knowledge, but as a provider, I hope everyone is giving the right advice for our patients and diagnosing properly and not overtreat our patients, especially our pediatric patients. Yes.
Yeah, because I think we create other issues. Yeah, where there is overexpansion and no occlusion. I think one of those issues are already beginning to come out.
Yes, I believe so too, and especially with our adult population.
Yes.
With children, it's a bit easier. Treatments are a bit easier, more straightforward. Yeah, but we still have a lot of over-treatment.
Yes.
And this is why sometimes our parents are not very trusting of our advice. There are many over-treatments out there.
Talking about parents, do you think in part of treating pediatrics, managing parents, are they part of the game?
Oh, definitely they're part of the game. I feel like a lot of the treatments that I do for my patients, I need the parents to participate. And I need them to understand why I'm doing this. And yes, parents are definitely part of the game.
Okay. Coming back, myth busting. All right.
Yeah.
Through and forth. Let's play this. All right. Since I've known you long enough, and they wanted me to play this, and not a bad idea.
Yeah.
Kids don't need to see a dentist until all their teeth are out.
False, of course.
When should they start?
They start by the first tooth when it first erupts, which is around 6 months, honestly.
6 months,
Yes.
not 1 year.
When the first tooth erupts, or latest by 1 year old. Latest by 1 year old.
So if it's 6 months, which means it's an infant that you're bringing to the dental clinic.
Yes. Yes.
So you see them at 6 months.
Yes, because usually when the first tooth erupts, it's around 6 months. Some kids are earlier, 4.5, 5 months. And the reason why we're doing this is because there's a lot of early childhood caries from bottle feeding overnight. And I've had children that I need to put under sedation for dental treatment, cavities, when they're 12, 13 months. Because they're feeding overnight. And this could have been prevented, right? And if they knew, they're not supposed to do that. Yes. But they don't know.
Yes. You don't know what you're doing. Sometimes ignorance is bliss, and it's not parents' faults. It's just not knowing.
Yes, not knowing.
Yeah. Number 2, sugar is the number 1 cause of cavities.
False. Cavities is really it's a multifactorial thing. So yes, sugar will cause cavities. But also, what about the bacteria that causes cavities? Where do they get it from? The bacteria is a direct transmission. So if the caretaker had a history of a lot of cavities, so they will have a lot more bacterial count. And if they're sharing food, or they're even like kissing their kids a lot, right? The bacteria gets transmitted to the kids, and these kids, even if they're brushing really well, they are very prone to cavities. Frequency of eating. If they're eating very frequently, more cavities. If they're food pouching, cavities. If they're mouth breathers, they get more cavities. So can't just blame sugar.
Yeah.
Yes.
That's true. That's true.
Yeah.
I'm so glad you shared that, because that's this biggest myth.
Yeah, there are many things that the combination will cause cavities. Yes.
And that brings us, is mouth breathing harmless?
Oh, no, it's definitely not harmless. It's very harmful. Well, we know that mouth breathing, they're not nasal breathing, mouth breathing, they're not in deep sleep. These kids roll around in bed and they start getting cognitive development issues. We see frontal lobe changes, which affects their focus, organization skills. These kids may start getting ADHD symptoms, right? And on mouth breathing, narrow jaw, narrow palate, no room for your teeth to grow, no space for your tongue, more airway issues, right?
Yes.
So no, kids are not supposed to be mouth breathing. And a lot of times when we see babies, they're sleeping, right? Their mouth is open. Oh, they look so cute, but that's not cute. They're not supposed to be open. It's to be closed. Yes.
So even at infant stage, at 6 months, or
we should be looking at them and see, why is the mouth open, right?
When they're sleeping. And I think a lot of parents don't realize that.
Yes, no, they
and
don't.
The community don't.
They don't. Definitely not. I didn't know this before I looked into the airway as well. Yes, but definitely not okay. Yeah. Especially snoring also. Parents find it cute when the kids are snoring, but it's not cute. They're not supposed to be snoring unless they're really tired or they're sick, right? But more than 3 times a week of snoring, definitely not okay. Something is wrong. Something's blocking their breathing.
So those are indicators, and I hope everybody hears this.
Yes.
All right. Pacifiers are always bad.
This is like a controversial question. In my view, I don't like the pacifier. Because the pacifier causes a lot of craniofacial or the palate development, a lot of changes. Oftentimes, well, it also really depends on what type of pacifier they're using as well. So the pacifier that are more round will cause, a lot of times causes more changes to the palate. You get a very deep palate. Sometimes they get more of an open bite. And there are orthodontic pacifiers out there which cause less changes, but it also depends on how hard the child is sucking on the pacifier. The more pressure, the more changes. So I don't prefer the pacifier, but if the parent asks me, should we do the thumb or the pacifier? Then I would suggest the pacifier, because you can take it away, but you can't chop the finger off.
That's true. That's true. Dental sleep appliances are so crazy now. Are they only for adults, or do we start treating them?
So for kids, it's not dental sleep appliances. It's our normal early intervention that we have been doing for the last don't know how many years. Yes. We have always done an early interceptive treatment on our children to guide their growth and development. And there's so-called sleep appliances to help them, let's say, move the mandible forward if they're retruded, to help them widen the palate if it's too narrow. Yes. And we have always done that. Yes.
That's true. That's so important. Which a lot of people there's a lot of misconception out there. That's why. Now, last one. All babies have tongue-tied, because there are a lot of advocacy of releasing the tongue-tied now. And is it true that all babies have tongue-tied?
No. No, not all babies have tongue. I think with the tongue-tied, I do see a lot more than before. But I think the reason is we didn't know how to diagnose them properly before. Because back in the day when we were in dental school, the tongue was not something that we really studied. And we have always thought the misconception is we have always thought tongue tie is always related to just speech. But now we know that's not also. And the assessment of tongue tie is not sticking the tongue out, but rather lifting the tongue up, which is the most important position for the tongue. So the way we diagnose is different now. And so this is why there are a lot more, it seems like there's a lot more tongue tie releases that are being done. And also with the knowledge and the research on airway and growth and development, we know that we need the tongue first for breastfeeding, and then for eating solids, for breathing, for our airway, and for our craniofacial development. The posture of the tongue is very important. So I think because people are looking more into these issues, these functional issues now. So we're seeing more of it.
I see.
Yeah.
I see. Yeah, and I think it's hard to get to the right specialist, because between the ENT and the dentist, who should decide?
I think it's really the diagnosis, right? Your ENT and the dentist, or your pediatric surgeon, everyone would need to be aligned on how to diagnose the tongue tie properly, how to assess the function, right? If that there are guidelines out there now. And we shall also work with your myofunctional therapist or speech therapist to assess whether the tongue function is correct. Instead of diagnose, we need to release this tongue tie without figuring out whether the function is okay or not. We shall also work with, this is where the multidisciplinary comes in. We shall work with the speech therapist or myofunctional therapist, so they can do the tongue or swallowing assessment to see whether we really need this to be released, or can we practice exercises to improve the function. Yeah.
That's such an important information.
It's very, very important. Yes.
Yeah. Instead of just going in there snipping everyone.
I don't believe, a lot of times I do see I think we're able to diagnose the structure. Yeah, we can diagnose, yes, there's a tongue tie and it's how far from the tip of the tongue or how thick it is. But the function, we're not trained on function. But we have help out there. We have other colleagues that are trained doing that.
Yes.
And then we should work together to see, to help diagnose properly. Yes.
Well, finding them, it's also, finding a good one is also difficult. What qualifications do you think we should look for, especially when it comes?
So I think a lot of times we shall be looking for speech language pathologists or speech therapists who are very familiar with the swallowing functions and the functions of the mouth to help us diagnose these tongue tie, whether to see whether it's too restrictive and they can't swallow, or yes, they can practice to improve the muscle function.
That's a difficult one. That's a very difficult one. Okay, given that there's so much of technology nowadays, do you see any new device or anything that comes out that's going to help parents or help pediatric dentists make things easier? Yeah,
I think it's the AI technology that we have nowadays. I believe a lot of different dental disciplines are also looking into stuff like that. AI diagnosis, right, and treatment planning. Hopefully streamlines everything and makes it more efficient. Can probably help us look at x-rays, we see details that we don't see and pick up things that we may miss with the human eye. And also with this, perhaps, your VR, your AR, to help our children to because the greatest thing with kids is the fear of going to the dentist or fear of the unknown, right? So, AR, VR stuff that could help ease their fear.
Oh, that's so cool.
Or tell them how the appointment would be, before they come. And this is especially important for my special needs children. They would need a lot of stories. We have these paper drawings or books of social stories where we show them before they come. But of course, with the AR and VR stuff, it's a lot easier.
That's right.
Yes.
Yeah. Oh, that's so cool. The world is changing.
Definitely,
changing.
Yes.
Gaming as well. It's just going to change how we do it. Yeah. Oh, thank you so much for coming on to our talk. And I think we've almost come to the end. And I would like to say thank you. And it's a small little gift for you, because this started due to this designer that really inspired me on bringing joy into everybody's life. And this is for you.
Thank you.
Yeah, and for your
This
son
is so
as
cute.
well.
Thank you. Thanks
you're
for
welcome.
having me.
Yeah,
It was wonderful speaking to you today.
No, thank you.
Yeah.
Thank you.
Thank you. So
And I
cute.
hope that we're going to bring a lot of joy and that you're going to come back and explain a lot more about pediatric dentistry.
Oh, definitely.
for us,
Yes.
especially on airway. I think that's
Definitely.
one major topic that we need to keep hammering and keep going on
yes,
and
I
explaining.
believe so.
as
Yeah.
well.
Yeah.
Yeah. And we're going to run some courses together with you as well. Hopefully everyone's going to pay attention. And
It's my pleasure to come hang
Yes.
out with you guys again.
Yep. Thank you
Thank
again.
you.
All right.